Good morning everyone. I am Dr. Nandini Mitta. I am the consultant neurologist and epileptologist at SPARSH Hospital-Yelahanka. Today I am going to talk a few words about epilepsy. The epilepsy is a chronic neurological condition which affects around 50 million people worldwide. And it is leading to significant mortality and morbidity and affecting the quality of life of the people who are affected with epilepsy. So I am telling you briefly about what is meant by epilepsy. Epilepsy is tendency to have recurrent unprovoked seizures. So seizure is, if you come in the layman term, it is a sudden abnormal burst of electrical activity within the brain. Means the brain becomes suddenly hyperexcitable, leading to the different types of seizures. So seizure, it does not mean like the tonic-clonic activity of the brain only. So it can be the conversion, and it can manifest in various other forms also, like suddenly patient becomes staring look and sudden brief loss of consciousness and falling to the ground. So there are different, and they have different aura, means they have different experiential sensations happening in the person. So seizures can be treated in 2/3 of the cases. They can be treated with the medication alone, but in 1/3 of these epilepsy cases they become drug resistant. So by definition, drug resistant means when patient had adequate trial of at least 2 well tolerated and adequate dose of 2 anti-seizure medicines, but still they are having significant frequency of seizures affecting the quality of life, then they will qualify for the drug resistant epilepsy. So if you take the usual causes of seizures, they can be primary or secondary. Primary means the genetic tendency to have the epilepsy. They can run in families, or they can happen only in that particular person alone. Coming to the secondary epilepsy, they are due to the structural damage to the brain, maybe due to the congenital malformations within the brain, or structural injury to the brain due to prior infections or trauma happening in an earlier stage of life. So the drug resistant epilepsy usually are due to the structural causes. Coming to the treatment options for this drug resistant epilepsy, patient need a comprehensive evaluation with video EEG, means we have to record the seizures. When during that time we will be seeing the focus from where the seizures are coming, and a proper quality MRI and further evaluation with PET MRI and other investigations needs to be done. So if there is a focus, like the seizures are coming from the particular focal area, so that structural can be curable with the surgical treatment, dissection of the structural lesion, which can be done. So if the patient is not fit for surgery, or the seizures are coming from a important area of the brain, which if we resect, this leads to the damage to the significant disability to the person, then we have techniques of the neuromodulation, like vagal nerve stimulation, responsive neurostimulation, deep brain stimulation. These are the different techniques available. So this will not lead to complete seizure freedom, but they will have a significant reduction in the seizure frequency. So coming to the other treatment options are like ketogenic diet, which is helpful more in the childhood genetic epilepsies. So this will lead to the reduced seizure burden. So main need is to identify the person with drug resistant epilepsy at an earlier date, which can lead to the proper cure of the epilepsy.